Hi, everybody.
Hey there, Pam.
I'm in a pretty public place too, so just like Patty, I might have to mute and get rid of the video once in a while.
So are you at a restaurant?
Did somebody ask me something? No.
Yeah, I said, are you at a restaurant? And therefore, what are you eating?
French fries.
Claim to fame.
I'm at the brewery in Glenwood Springs and I'm having fish and chips.
Oh, okay.
Hopefully a beer too, but
I was going to say brew.
No, I don't drink beer, but there might be a glass of wine coming. I'm not sure yet. It's nice to see you.
Well, Patty, when you have yours, I'll get mine.
Okay, we can toast.
Okay.
Hello, everybody. I just found the link. Somehow I keep getting lost. I apologize. The Zoom link just eludes me, but I'm here. So give me a second.
So Greg, I'm here. Greg, I'm here. I'm in a restaurant, Glenwood, so I'm gonna mute and stop video, but I'll be here.
Okay, thank you.
All right.
And Anne's in a similar situation, Greg. And then I was just wondering, it's been a little while since we've had Claudia join us. So maybe when you kick it off, we can do just some hellos and introductions.
Okay,
That's a great idea. Excellent. Hi, Claudia. Welcome. Okay, pulling up the agenda here. So I want to call the meeting to order. It's 1 p.m. It looks like I'm going to, it appears to me that we have a quorum at least. Is anybody not here? Just raise your hand.
Oh.
Okay.
I don't see Tori, so I'm in for Tori then until he shows up.
Okay. Yeah, I just saw him in the last meeting. They're starting to blur.
I don't see Dr. Kurt either.
Well, I think we're gonna start moving here. I think they're gonna log in if they're around. A review of the agenda. Do we have any additions to the agenda today, Jordana or Suzuho or whoever would like to weigh in? I don't see anything. Okay. I think I need a motion to, well, do I need a motion to approve the agenda? Is that right?
Yes.
I'm looking.
Yep.
Thank you, Marky, for keeping me on track. A motion to approve the agenda. Was that Marky you offered it and then Krista seconded?
No, I'm not a voting member.
Oh my God, thank you. See how long it's been? I see Krista and Jeannie have made a motion and seconded it. All in favor, raise your hand and we will keep moving here. Thank you very much. Do we have any corrections for the previous minutes? Anybody like to add anything? Okay, I need a motion to approve the previous minutes.
Greg,
Jeannie?
real quick, I just wanted to chime in real quick. Sorry to interrupt.
Yeah.
Since Dr. Kurt is not here, Claudia, you do have a voting. A vote.
Thank you.
Yes, in the process.
Okay, and we're gonna we'll do a little round robin. I just wanted to get through this. I had a motion to approve the minutes from Jeannie. Do I have a second?
A second.
Anne. Anne. Okay. All in favor, raise your hand. Okay, now we can relax. We're all here. We can relax. And yes, thank you. Introductions, Claudia. It has been a while. Tell us about yourself.
Oh, thanks. I've lived in the Valley 18 years. I work in healthcare and I'm very interested in community engagement. So I'm happy to be here and join you all.
Great. Thank you for being here. You know, it was suggested to me at a recent meeting that we make sure everybody knows who everyone is. And I remember I singled out Linda at one point to talk about all the great work she's done in the past. And somebody said, well, what about the rest of you all? And everybody is such, I have such esteem for everyone. We should do that for all of our Board of Health members. And eventually we'll do that with the staff as well, because we have a regular team of regulars here that should all be familiar with the county or with the community. So if you don't mind, Jeannie, I'm going to pick you to start. Tell me very quickly a little bit about your background and who you are.
I'm a physician, pediatric anesthesiologist, and currently working with the school district as a medical advisor.
Fantastic, thank you. And then Krista, I'm coming to you.
Thank you, Greg. I'm Christy Giesel. I'm a board certified internal medicine doctor. I've worked for the Veterans Administration in a primary care role for the past 11 years. Also helping Jeannie right now with the school with the medical advisory position as well.
Great, thank you. And then Marky, you are, I don't want to overlook you, so I'm jumping to you next. Your incredible career in public health and in health.
Yes, I've been in healthcare, oh my gosh, over 50 years now. It doesn't seem possible, but that's very, very true. And most recently chaired this wonderful board. And I think I chaired it for about 4 years from
You
the
did,
very
yeah.
beginnings. So really enjoy it. And at some point today, if we have time on round robin, I'd like to talk about my experiences just coming back from Austria and how they're dealing with COVID, and very superior. So some thoughts that we might want to consider in the future.
Great, thank you. That'd be interesting. Anne, tell me about yourself.
Career landscape architect, but former city council person for 8 years, and really, along with Marky and a few others, led this change from community health being our public health service to a board of health, public health director, et cetera, and this experience-based board, which has been so incredibly valuable, especially the last year and a half. So.
It certainly has, and it's so good to see you here and to see you involved in so many things in the community. Tori just joined us. Tori, we're just doing a quick introduction. I don't think you need one, but go ahead, give us the intro.
Hi, I'm Tori. I'm the mayor of Aspen. I've lived in Aspen almost 30 years at this point. In my working career, I am a tennis instructor and I run a small club here in town.
Great, thank you. Linda, would you mind saying something?
Hi, I've been in the Valley for 44 years. So I delivered babies for about 35 and in private practice. And also I work at Community Health Services, probably the longest employee they've had. I'm a certified nurse midwife and advanced nurse practitioner in women's health.
It's fantastic.
Question for Linda.
Oh yeah,
Question
go ahead.
for Linda.
Yeah.
Linda, do you have a count? Do you know how many births you have attended over the 35? Do you know the number around the number?
I never really kept track, but it's definitely over 1,000, I'm sure.
Oh, that's awesome. That's awesome.
Think of 1,000 kids who have your fingerprints on their butt. Okay, I'm moving to Dr. Kurt now. I see you've joined us. Hello.
Yes, well, like Marky, I've had 50 years of experience, so I could speak to you for a few minutes about the background. I have took my residency in internal medicine at the University of Colorado Medical Center, and then a fellowship in cardiology. Then I was on the faculty. I was head of the university's health service for employees, started a clinic at Stapleton Airport, worked in emergency rooms for about 8 years, the university emergency room, using the Harvard Public Health information that I got to study Denver's air pollution. And then I went to, I got involved with the Rocky Mountain Poison Center in Denver, went to Dallas to help found the Poison Center that's in Dallas. I served as the regional medical officer for the FDA in Dallas. I was involved with a myriad of research, and then semi-retired back to Aspen back in 2004. And I serve on the faculty of the Colorado School of Public Health, and I'm still on the clinical faculty of the UT Southwestern Medical School.
Wow, thank you. That's a mouthful. It's thank you, and we're grateful to have you here. Bill Madsen, I see you're on here.
Thanks. I am the mayor of Snowmass Village. I don't attest to having any medical history, although my mother did come to Aspen to start public health many years ago. So other than the time I've spent in the hospital from numerous injuries, yep, I'm just happy to be a part of the board.
Thanks, Bill. I don't know if Patty's still monitoring us.
I'm here. My lunch has not been served. Thanks, Greg. I've lived in Aspen for 41 years. I've been in the medical profession 40-something as a registered nurse, and prior to that is a medical assistant for various practices, and my lunch is coming right before me now. And I used to serve on the board for community health when I was first elected, so in the early 2000s, and now I'm Greg's alternate, so I'm his backup cheerleader. I'm on the Board of Health, and I thank you all for being here. And I'm going to go back to mute and stop video and have my lunch. Thank you.
Excellent. So if I freeze up, Patty will step in and take over. Or actually, Krista would, being the vice chair in that case. Have I left anybody out? Is there anybody else we need to recognize on our board here?
I could give you my background, Greg.
Yes, please do, Claudia.
Okay, thanks. So I have a fraction of the time as of a lot of others on here, but for a couple of years I've been in healthcare. I work at ABH as an ER and clinic tech, and I've been with Roaring Fork Fire as a volunteer and now an employee, and I'm currently working on my paramedic certification. So that's my short healthcare career. Prior to that, I was in offices doing office work.
Fantastic. I remember looking at your resume when you applied to come on, and we're so grateful that you applied, and I'm so glad you're here. So thank you. I think we've got the full range here, which is great. And I promise I should do this again. I'll do this with staff at a future meeting as well, because we have such an esteemed group of people here. We have a lot of fairly new faces in our public health department. So I think it'd be smart to introduce the public to all of you as well. And I promise to do that in a future meeting. Okay, we're moving. Oh, hello. Do you want to jump in there? What?
What about, do you want to give an intro?
My name is Greg Postman. I'm a Pitkin County Commissioner. I'm the current chair. Thank you, Jordana. Chair of the Board of Health. I have no medical background. And so like what happens when you're a county commissioner, you often walk into rooms of meetings with people, rooms full of people who know more about the topic than you. And this is a perfect example of that. And so what I try to do is chair the meeting and stay on top of that and let the medical decisions rest with the people who know. So that's me. Thank you. I was born and raised in Aspen, by the way. I'm the product of a couple of avid skiers who discovered Aspen in 1950. Okay, let's move right along. General Board of Health Business, Suzuho, you're teed up for that. I'm going to give it to you. Thanks.
Perfect. Thanks, Greg. Hi, everyone. Good to see you all. So I just wanted to talk through a couple things for administrative pieces. So one is around our bylaws. So if you can go to the next slide, please. You might remember that a few months back, we had a conversation about how challenging it is when we have our elections first, and then we have the board appointments after the election. So that's the first thing that we wanted to change here. So you'll see the track changes of what we want to change in the bylaws. So having the elections move from Q1 to Q2. Any questions or comments around that? If not, I'd like to just put this together in one vote rather than doing two separate ones. Okay, it's pretty straightforward change. Thank you. And then next slide, please. This is a little bit more complicated, but hopefully not too much more. So this is just reviewing the language that we had in our bylaws around how the Director of Public Health is appointed. So there were some conversations during the most recent transition where we realize we need to clarify the language in the bylaws a little bit more. So a few things to note here. One is really clarifying that the Board of Health is the body that appoints the public health director, and then the Board of County Commissioners ultimately has oversight of the budget. So salary negotiations and things like that need to be done between the county manager's office and within approval of the BOCC. But the Board of Health would appoint the director and make a recommendation for that salary range as well. And then the county administration office and the human resources department would help support kind of the onboarding, hiring, follow all of our county procedures. The director is an employee of the county, not contracted, so just working within all of those policies as well. So you'll see the track changes here also, but any questions or discussions here?
Great. I can't see everybody when the screen shares up. So yeah, announce yourself if you would, and we'll go from there. Thank you. Conversation, questions, comments? I'm not
This looks
seeing.
great. Do we need a motion to approve it?
I think we need a motion.
So, yeah, if we don't have any comments, we'll need a motion to make a recommendation. The bylaws actually, I was reminded, thank you, Charlotte, if you're watching, need to be reviewed and approved by the BOCC. So it'd be a motion to recommend these changes to the bylaws to the Board of County Commissioners.
I see Dr. Kurt's hand up. Do you have a question or a comment?
I move that we take the recommendations.
I need a second. I've got a second from Krista. Thank you, Dr. Kurt, and then Krista. All in favor, raise your hand, and this will go on to our Board of County Commissioners. Thank you, Suzuho. That was great. Quick and easy. Do you have anything else for us here?
I do. I wanted to do a quick overview of our budget as well. So thank you for that quick vote. And then in regards to our annual budget, we are scheduled to present in front of the Board of County Commissioners on the 26th. So just wanted to present a high-level overview of this to you all before that presentation. So this is just a reminder. I went over our org chart last meeting, but this is the structure where we are right now. The blue boxes are the positions that are ongoing, and then the red boxes are our COVID-specific hires. And then next slide, please. You'll see the proposed org structure for 2022. So you'll see that we changed the color of the red boxes to green, but the green boxes are the COVID positions. We're really trying to group them into one core team under the environmental health section of our department. We are also going to present two positions that are ongoing. They're kind of that grayed out blue boxes. So on the very left, you'll see the planning analyst, which will be the position who's going to help us out with our community health assessment, our 5-year public health improvement plan. Those are both elements of our core public health services that are mandated services here in Colorado. And then the permit tech, who we currently have as a term limited position, but with the increasing development and need for OWTS permits, we're hoping to make that position ongoing as well. So that's just a quick overview of our org chart, reminder from what we went over last month. And then next slide, please.
Hold on just a sec, if you don't mind. And Jordana Suzuho, I just had a question regarding communications. It looks like communications, community engagement is in the COVID section. But how will general communications from public health department be handled?
Yeah, great question. So all of the COVID communication would be through that position that you pointed out, partnering with our communications team under the county administration office. So we have a director of communications and community outreach or community engagement. And then Laura Armstrong is in that position. And then all other communication, really depending on the level of it, does fall under the administration team. So Jordana, myself, the planning analyst may also be involved. So that left team that you see here on the org chart helps with the communication in partnership with our PPP team, as well as the environmental health team. So the environmental health team really focuses on, outside of COVID, air quality, water quality, other disease investigation efforts, whether that's foodborne illnesses, TB. They might be all involved, like our emergency response and preparedness efforts. All of those pieces of environment fall under environmental health. And then the PPP team really works on like our mental health efforts, our tobacco, substance use prevention, child fatality reviews, some of our equity work as well. So our admin team would be partnering with the program staff, depending on what the communication is, whether it's a media event, press release, media campaign that we're doing. We've often put signs over Main Street, things like that. So that's a partnership across the department, depending on the topic and the extent of that media campaign.
Great. The last question about community relations, community engagement would be how if somebody wants to call public health and ask us question, whether it's about a mental health issue or about a COVID issue, who are they going to call, and how are they going to know who to call?
Yeah, so our main line is still in full effect. So if it's the COVID number, it's calling the COVID hotline or the COVID call center. And then, oh, now you're testing my memory. I think it's, Lindsay, do you know? I think it's 920-5070. maybe is our main line. I will find out and get back to you all. It is on our main website, so pitkincounty.com/public health. We haven't had as many calls this year since most people are calling the COVID call center, but we do still regularly get calls from the public. So that line is still available.
Great. Thank you. I appreciate it.
Yeah, of course. Great questions. So then if we can go to the next slide, we wanted to provide an overview of the changes that we are proposing to the budget. So the first you'll see here is the general public health or the administration team there. We are expecting an increase in revenue from our Senate Bill 21-243, which is part of the ARPA funds. CDPHE, which is our state partner, has plan to distribute their appropriations to each of the local public health agencies, and the portion that we would be getting is around $60,000. It's $10 million that they are distributing across the 53 local public health agencies through ARPA funds this year, and then the subsequent 2 years will be through general funds. And then the decrease here isn't necessarily a decrease, but we did receive some funds from the town of Snowmass as part of the CARES Act funds that they had received. They had allocated to our department to help support staff who are designated to really serve the Snowmass community. So we had a consumer protection position, a contact tracing position, and I'm forgetting the last one, but we had some staff designated to support the town of Snowmass. So that was a one-time contribution that was made. And then the preventative block grant is our funds that come from CDC through CDPHE. So these are federal funds. We had received $55,000 to really work on our health equity efforts that came out of the Protect Our Neighbor grant. And that was for federal fiscal year 21. And then the amount that we've received for federal fiscal year 22 is $22,000. And so that's a $33,000 decrease, but still some additional funds that we're able to put towards our community health assessment and ongoing health equity work. In regards to expenditures, we are proposing a additional staff, so that planning analyst that I mentioned that was in the grayed out box. And then we also have recently brought on a temp admin specialist. So Abril, who some of you might remember, who's our admin assistant for the COVID team, her last day with us will be next Thursday. So to help us through the winter and through this transition, we brought on Alicia, who will be with us through the end of March. So some increased expenditures there. And then because we are moving all of the COVID positions under the EH team and budget, we'll have a decrease in that general public health or admin budget related to the term limited staff that we had under that part of the organization. Any questions around that before I keep going? Okay. Planning partnerships and planning prevention and partnerships. We are getting a little bit less money from the Office of Behavioral Health for our co-responder grants. This is one of the 2 grants that supports our PACT program. This was due to the fact that we had some challenges filling the staff, the clinician, PACT clinician positions through Mind Springs Health. And so because we were unable to spend down some of those funds during this last fiscal year, they reduced the amount that we received this year. But we feel that the amount that we're getting is still going to be able to support the PACT program as it's been functioning thus far. And then similarly to the general public health funds, a decrease in the term limited staff. So we had 2 subject matter expert positions specifically to COVID under this part of our department, who the work will be transferred over to the disease investigation part of our team. Environmental health will have an increase, anticipated increase of about $14,000 through operating permit program fees. So this is the program that Kurt presented on a couple meetings ago. So increased revenue stream there. And then the Radon Grant we had applied for previously in 2020. We had a lot of radon test kits still left over since we didn't distribute as many through the community during the start of the pandemic. And so we didn't apply for it during the last state fiscal year, but did receive the $5,000 again for fiscal year 2022. So expecting an increase there. And then the permit tech position that I just talked about as well. So hoping to have that approved by the BOCC in a couple weeks. And then the last part of Our budget is related to the disease investigation team. So there are 2 grants that we've received to really support our contract tracing efforts. Both of them are this ELC funding, which is the epidemiology and laboratory capacity for infectious disease. And so ELC 1, we have already spent down. So that was about half of what ELC 2 was, so $380,000 approximately. We've spent that down and are starting to spend down ELC 2 funds, but still anticipate having a larger portion of that ELC 2 funds for year 2022. And then immunizations, we've now received 4 rounds of funding specifically for COVID related immunization efforts. The first was around $12,000. The second round was around $137,000. So we have about $80,000 of that left over. And then you'll see the amounts for round 3 and 4. So we anticipate again, a little bit of an increase there based on how we're spending these funds down. Both the ELC and immunization funds are available through June of 2023. Yeah, 2023. So that's why we're also aligning our staffing term limits to that. And then decrease around disease investigation is, as you saw, with the number of red boxes compared to the number of green boxes in the org charts, we will have fewer COVID response staff based on our anticipated needs and changes there in the coming years.
So Zohu, I have a question just regarding about the PACT program. We did not get a PACT grant for, I guess, an additional counselor. Is that correct? But it's because the need wasn't there, or can you give us a quick overview of the program, because we've all been so excited about PACT.
Yeah, definitely. So the PACT program started in 2019. I believe, at the end of fiscal year 2019, state fiscal year. And we had PACT clinician through Mind Springs Health that was supported through that initial grant was 4.5 years through the Office of Behavioral Health, which is under the State Department of Human Services. We actually did receive another grant last state fiscal year to bring on another clinician. And so that is through CDPHE's harm reduction grant. So we have the co-responder grant and the harm reduction grant, both of which fund the PACT program. So we were able to get that second grant, if that's the one you're talking about. If it's the third one, I don't think we've received that yet.
Okay, thank you for that.
Right now.
Yeah. Okay, thank you. What's next?
And then the last slide, sorry, is just the 5-year plan to give you a sense of what we are projecting over the next 5 years. With our budget, you'll see a lot of support from the county general funds as we continue to work through this pandemic. Our ending fund balance is about a month's worth in regards to our expenses. And so we really want that to be about 2 months worth of operating expenditures. So still lower than where we want it to be, but given the circumstances of being in a pandemic. And as many of you know, we are still a very new department, half of the time, which has been in a pandemic. So given that we're about 4.5, 5 years old as a department, we anticipate slowly growing that fund balance over time, but wanted to give you a quick snapshot of what we will be presenting as our 5-year plan.
Okay, any questions? Anybody out there? Raise your voice if I don't see you. Okay, we're going to keep moving here. I've put us behind schedule. So if you're finished there, let's get to Chelsea mental health update. I'm going to put you on fast forward, Chelsea, but thank you. Ready to go.
Sounds great. Thank you, Greg. And thanks everyone for having me. I really want to emphasize that the attention that's being paid to mental health right now by the board and so many other community leaders is really so crucial in making us effective, both the department and our community partners. So we just wanted to give you a kind of catch everyone up to what's happened from our Pinken County view, and then update everyone with what's happening and what's to come. So far, again, just from this Pinken County view, my position, the mental health analyst, was hired in April. Once I was hired, really worked hard to start making some connections valley-wide, and wanting to map out what organizations, funding sources, and what some of the overarching needs are in the Valley within our local mental health systems. Those connections span from local providers and stakeholders to some of our neighboring government agencies like in Summit and Eagle. We also had the mental health coordination team, which was already in place from the spring of 2020 in response to any mental health needs that would come from COVID. We are maintaining that group. My position is co-leading that group with the director of Aspen Strong, whose name is Angelina Taylor. Moving toward early summer, we did start detailing into what that asset mapping looks like, who is where and what are they doing. Again, trying to understand the funding streams, where do they go and what the potential is. Trying to learn the history from these several different viewpoints of the organizations who have been involved for 10, 20, 30 years in the Valley and what they've seen as successes and some room for improvement. We've also been trying to be very intentional about traveling and learning from some neighboring counties and organizations who are finding success, like again, Eagle and Summit. Moving into the summer, across the board, we were hearing and seeing a need for messaging. We worked quickly to try to see what we could do to fill this from our neutral perspective as public health. In doing that, we created a quick at-glance mental health resource guide, just a one-page accessible sheet for community members to look at and try to identify where different needs may be as they have them. With this, we decided it needed to be housed somewhere. So two mental health specific URLs were created, and that is pitkincounty.com/mental health or pitkincounty.com/sanamente, as everything is available English and Spanish. Also with those resource guides, we've also created some materials. So there's QR codes that can be found on flyers as well as some stickers. And those are scannable and lead directly to our mental health websites. Additionally, we have some writing pens with those URLs on them. And that those URLs are connected. We made sure that we were intentional in checking in with human services, as well as outside partnering agencies to see who and why are we keeping everything current and not stepping on anyone's toes. So right now, from early in this school year, if you will, to currently, there was a lot of studying and searching to try to find any data sources that may already be in existence that could speak to our mental health systems locally. So this meant searching, building and doing an analysis of what had been learned about what was already available in our area for data. From that, we were able to see what is missing and what we need to know more of. And that was really helpful and informed by some of the history that we had learned in conversations previously. So with the previous data analysis and just context and anecdotal information, we have created a community mental health needs assessment that is now open to the community. And I'll touch more about that in a few moments. Additionally, we are making sure that we are still keeping informed of what funding opportunities are available outside of Pitkin County Office of Behavioral Health, and those ARPA funds are a great example that apply to behavioral health as well. And we're also wanting to make sure we're maintaining connections with ongoing data sources, whether that be the hospitals or one-time efforts like the Protect Our Neighbor project or a Western Colorado LGBTQ assessment that's out right now. We, of course, are also maintaining our vital mental health services contract and program that we oversee within the county. And my coworker, Jenny, is overseeing PACT. Next slide, please. So now to dive a little bit more into what that survey looks like. That survey opened on October 4th and will be running until the end of November. In order to get a robust amount of information that paints a pretty clear picture of what our needs are, we created 3 different prongs. There is, of course, the community member survey, which applies to anyone who lives, works, or learns in the Valley, or in Pitkin County, I'm sorry. There's a stakeholder survey, and this is for anyone, any organization who relies on referrals to mental health providers. And finally, we have a provider-specific survey, and this, of course, is for those who provide direct mental health treatment or support to community members. The strategy in trying to engage people and get as much participation as possible is just meeting people where they are, trying to show up at the right places at the right time, being personable and showing the need and being very accessible and expressive about why these are important, and making sure we're able to communicate that by being present. So this has meant a lot of contact with our partners, asking our partners to share information or flyers, asking to attend events, whether that's peer support groups or team meetings, hanging flyers in break rooms, or for instance, last week we had a peer support group for hospitality workers. So we were there, just trying to get there and see who we can get involved. We really would like working class and particularly Hispanic participation, as those historically are lower numbers in participation. Outside of the survey, some updates on what exists within our community, not even specific to Pinken County, but are good to be aware of. And this is a very brief overview and by no means does not serve or speak well in fulfillment to everything that's available. However, we do have, as I mentioned before, our Vital Mental Health Services contract, which is what we oversee in our Department of Public Health. And that provides 2 school-based therapists within the Aspen School District, 1 community-based clinician with 1 community-based caseworker. So they travel to different locations within Pinken County as needed. And we have within Mountain Family Health Center in Basalt, 2 behavioral health clinicians and 2 care coordination specialists. Additionally, we have the PACT program, also housed under our Pinken County Public Health umbrella. And that, as discussed, thank you, Suduho, there are 2 PACT specific clinicians out in the field corresponding with officers and 1 PACT specific caseworker. We also have, there are 2 police officers who are found in the schools within Aspen. 1 is our school student resource officer. We also have a behavioral health specifically trained officer who is not housed full time within the schools, but is there frequently as needed. Our Basalt schools contract with Aspen Hope for in-school therapists, as well as very recently Aspen Community School. Locally within Pinken County, Mine Springs Health provides our crisis services, and Aspen Hope does still respond and assist with any kind of morbidity incident command. So Aspen Hope is able to come and help kind of delegate tasks, talk to bystanders as needed. It's a wonderful service. And additionally, we have Aspen Hope offering mental health trainings for any setting, that could be school or work, and Aspen Strong, which is a website and kind of convener. They have a provider directory list on their website that they are frequently updating, building, reviewing, and making sure it's relevant. Next slide, please. Moving forward. So of course, we have some pretty high hopes with the information that we'll be getting from this survey. We anticipate really using that information to inform what the gaps are, but also to give Pinken County and our local organizations some really solid evidence and numbers of what we need funding for. And we've seen that that is a bit of a gap. As I mentioned before, the survey was developed in a way to show evidence of need from those 3 different perspective points. The provider needs can help us understand what barriers to treating people could be, whether that's maybe they can't afford to accept people who have insurance. Stakeholders can help us understand how much confidence do they have in referring to our local mental health providers. And of course, our community members have a vast amount of information that we can try to learn from. Once we have this information, we're able to analyze, and that we're looking at early spring as an analyzation and gap analysis process. We would like to make sure we're unifying our efforts by sharing what we find regionally. And of course, with providers here within Pinken County that we're already tapping into, in design programs that are going to start filling some of those gaps, trying to understand what we can do with the information that we learn. With that, and in a way that should parallel perfectly, we will again stay updated with what extra funds coming down, particularly from the state level, will look like, and how can we enhance those, and how can we let that flow with the efforts that we're making right now, regionally, locally, on a city level or on a county level. We're also participating in regional roadmap efforts, which are something that Kara within Pinken County is leading. And the purpose of that is to focus on problem solving on a regional level about certain topics. Housing is one, behavioral health is another. So we'll make sure that those conversations are ones we participate in. And of course, maintaining contracts we already have and seeing how we can build, rebuild, strengthen, whatever that might look like. Next page and final page. I know, Greg, I hope that fulfilled your speedy talking hope.
You couldn't go any faster. We're gonna have to make up some time, but thank you.
Of course. So that's again, that quick overview I included. These are some examples of the community member survey participation flyers that you may see circulated in email, talked about in some of our media outlets, or even just hanging signs up in the library or coffee shops. There are links to those surveys as you see above. And please, I invite and encourage anyone who has any ideas of how to further spread the message and gain some more participation for this survey, please let me know.
Great. Thank you, Chelsea. Anybody have a question or a comment from our gallery here? Just speak up if I don't see you.
Greg, I have a question.
Patty.
Yeah, is there another language other than Spanish we might want to put this out in? I know we have multiple languages in the Valley. It was just a thought that came to me because I think this is great. I mean, I think it's awesome. So I didn't know if we thought about that or what we think about that. Just something I wanted us to think about.
That's an interesting question. The times of year where you might want to have something in Portuguese, for instance, but I don't know.
I was thinking more of the Asian community.
Okay. Yeah.
Just a thought.
Thank you for that.
Thanks, Greg.
Krista has a question.
Yeah, thank you so much for this presentation. And it sounded like you are doing some outreach of some sort to some different community groups. I was just wondering, in light of what's happened at our school, and I know there's a lot of concern right now about the school, if you'd consider doing a school-based outreach.
That's such a great question, Krista. Yes, we are doing everything we can to try. There's, as you would imagine, a bit of dancing we have to do. There's some red tape there. So I do have a meeting with the school to try to talk about what those limitations are and how to be creative around them. So we do have plenty of staff members who are great and very eager to participate and see how we can get as much participation from kids as we can. But I think we're still at that point, at least until we have this conversation of how do we do it.
I think even engaging the parent community at the school, which again may be based at the school, may be something to consider too.
That's a great thought.
If I could, on that note, very quickly, pre-pandemic, before the pandemic, we had initiated a mental health first aid training program through Mind Springs Health, and they brought trainers in. We did a lot of trainings for adults. We did trainings for parents, and some of us parents were actually teaching the program in the schools, in the middle school. And it started right at at the end of the school year, and then it never got restarted. They had a change of admin, and it just never came up again. But I do know Michaela at the Aspen Youth Center was carrying the torch on that for a while, and maybe they still are. So I just wanted to make sure you reached out to them as well. But we do have some history with mental health first aid trainings and trained people in the community who I think would step up if we ask them to. It's finding them and organizing. It's always the hard part. I don't know if you wanted to say anything about that, but I just wanted to put that in your ear as you go to talk to the school district. And then Dr. Kurt, did you have your hand up?
Yes. Am I on? I could answer Patty's question. Poison centers, EDs, and other medical facilities usually have a telephone line that will connect with about 80 languages. I think you're required to do so. And I think Krista can affirm this as well.
Interesting. Thank you. So that could.
Thank
that
you,
could-
Dr. Kurt.
Yeah. Okay, I'm going to keep us up. We've got another question for Tori. All right.
Yeah, real quickly, mental health care and awareness has been pushed to the forefront of our priorities in the city. Hopefully, maybe you guys have already seen today's Aspen Times. If you haven't, you can read a quick article in the Aspen Times. Gives you a little update about the conversations at the council table. So I just want to take this opportunity to say that we are actively seeking to work with Chelsea and use her to amplify the messaging that we are concerned with getting to our community up here at the upper end of the valley, throughout the county, and even associating with other counties so that, a real regional approach. That's the first thing, is that we're embarking on kind of a, what started is really thinking about having just a community get together, a meeting, a little bit of training, if you will, at the Wheeler Opera House, is now taking on a little bit more of a longer term strategic plan about having presence and messaging, even on a monthly basis, and then some community get-togethers, again, on a more regular basis. So it's evolving, and we definitely want to be involving the county as much as we can and really utilize the county's resources to amplify the messaging, but also get direction and some input from Chelsea. She's been doing a great job of looking into current state of affairs here and really making an analysis about, again, what she just presented, filling the gaps basically, and what we need to be doing next steps. So I'm very excited about that, and just wanted to say that, maintain that conversation going forward. The one thing that I wanted to say here, and maybe that I'm looking in the wrong place, but I did take a look at the Pinken County Mental Health Resource Guide on the Pinken County webpage. And I don't know if it's intended to be a resource directory or not, but I think that page could definitely be more robust. It has 2 links right now to Aspen Strong, which is a fantastic organization, but navigating through those links and their separate website is a little different than maybe what a resource page could have for us on the Pinken County website. It'd be great to see a really a compiled directory of phone numbers and emails to get in touch with some of the organizations. The reason I say that is because the Aspen Strong links very much is providers, individual providers and such. So it's again, just a little bit difficult to navigate for somebody who's looking for the resource that they might need at a difficult time for them. So I would just make a push for that to maybe make the resource guide a little bit better on the Pinken County website. Thank you so much.
Thanks, Tori. And we have actually updated it on the other. We have 2 websites for our public health at this point. One that's really the COVID resources, and one that's our old county website. And so I think your point is very well taken, that we can assure that our new website is linked here with that is where we do have more of that robust linkage to all of the mental health services that are currently available. So we'll work on that.
Thanks, Jordana.
Okay, I'm Chelsea. I think you're finished. Just want to make sure. Okay, so Jordana and Josh, I know we have a lot to cover. We're basically one full section chapter behind here, and we're rushing through this. So I think we're a little bit thick on our
Greg,
agenda.
I think I've got extra time built into the agenda, so I think we're going to be all right for folks just to keep working through their section.
All right, and then we're going to keep moving. Thank you. And so is it Larissa's up next?
Yes, good afternoon. My name is Larissa Danino. I'm the Planning, Prevention, and Partnerships Manager with the Public Health Team. You can go on to the next slide. I will try to make up some time, Greg. So I'm going to just provide a brief overview of the Fully Vaccinated Facilities Program, really within the context of the public health order that was issued on September 16th. So as you may recall, we had a public health order that was issued on September 16th that included a masking requirement for all individuals age 2 and older in all public indoor spaces during times of substantial or high transmission in the county, unless an individual was exempt due to being under the age of 2 or had a medical exemption or performing an activity included under the exceptions of the public health order, or if they are within an approved fully vaccinated facility event, which we will talk about that on the next slide. So the fully vaccinated facilities and events program that you may have heard about is completely voluntary. However, any business that is not participating in the program does need to require masks for all individuals 2 years and older, regardless of vaccination status, in those public indoor spaces. And so when the public health order was issued on September 16th, there was an opportunity for businesses that had already implemented a mandatory vaccination policy for employees and guests to apply for this program. So that is likely where some of the confusion came between two different dates of September 16th and October 11th, is we had allowed some businesses that already had policies in place to apply for the exception immediately. So, however, to allow our team a little bit of time to fully build out the program, generate some FAQs, and build out our website, as well as allow businesses that were interested in the program some time to develop their own policies, we set the official date for the program as October 11th. So the online application and approval officially opened on this Monday, October 11th. And so the program is designed to be very flexible, so it can apply to offices, gyms, retail stores, restaurants, event venues, a single event at an event venue, single rooms within an indoor space, or even specific class times or times of day. For example, if a recreation center wanted to have a specific fitness class that is fully vaccinated without masks, they could apply for the program to have that specific class approved under the program. There are some facilities that are ineligible, and these really include any space that is subject to more restrictive local, state, or federal orders. So this includes facilities such as long-term care facilities, healthcare, and facilities that are regulated by the Centers for Medicare and Medicaid Services, as well as PK through 12 schools and youth activities covered by our previous public health order, and public conveyances and transportation hubs, which is part of the federal order that has been extended through January of 2022. Next slide. So to become and operate as a fully vaccinated facility or event, the owner or the operator of the space will need to submit an online application that is available on our COVID-19 Pinken County website. The team will then review the application for two requirements. And really what they're looking for is first, a uploaded copy of a written policy on that the business or facility requires proof of vaccination for all individuals entering the space. And then second, they're looking for within that policy, how are they operationalizing it? And how are they demonstrating or checking for proof of vaccination? So additionally, it's recommended that the facility or event consider any medical or religious exemptions and how they plan to address individuals who might refuse to comply with the policy. So the team will either approve or deny the application, or if there's additional questions or clarification needed, they'll reach out directly to the contact to seek that information. And then once a facility or event has received the official approval from our team, the facility or event is required to post signs that proof of vaccination is required for entry. And we do provide these signs, as you see there on the bottom of the slide. We do provide these signs in the official approval email to that facility or event. And next slide. And so lastly, I just want to mention how the program kind of operates within the context of the CDC COVID data tracker. So as of October 13th, Pinken County is still in the high transmission level. So as according to our public health order, in alignment with that, once our status on the CDC COVID data tracker drops into the moderate or low transmission level for 21 consecutive days, and the order automatically releases the mask requirement, then masks and proof of vaccination for entry will only be recommended. However, it's still strongly encouraged that those approved fully vaccinated facilities continue implementing their policies, because if we do increase to higher substantial transmission for 5 consecutive days once again, and that mask requirement automatically goes back into effect, then those approved fully vaccinated facilities are once again required to check for proof of full vaccination among their employees and guests, or follow their policies that they had implemented. So if this did happen and we do go in and out of the substantial or high transmission, facilities and events would not be required to reapply. However, it's expected that they continue to follow the policies that they had previously submitted to our team. And so for just a brief update of kind of where we are with the program, we have 24 approved facilities or events. Most of these are office spaces or gyms or personal services and hotel event spaces. And we currently have 7 that our team is currently reviewing. And so just in summary, if you would like to learn any more information or share the program with your contacts, you can visit the website there listed at the bottom of the slide. And that was it for me, Greg. Hopefully I caught some time back up.
Well done. Thank you. Question from Krista.
You have the incidence rate on that slide. Do you know the % positivity we're having right now?
I bet Josh knows. I don't have it off the top of my head, Krista. I'm sorry.
About 6.5%.
Told you he knew. Thanks, Josh.
Right.
Thanks, Jeff.
Dr. Kurt.
Yes, I have a question separate from Aspen Valley Hospital. Can other facilities like the city of Aspen with the Wheeler Opera House or private facilities require all employees to be vaccinated?
So the way we're approaching this program is it's really based on the individual business or organizations decisions of how they want to operationalize or implement a policy. So we're just providing this program as an opportunity for a business that might be interested in implementing this, but really the legality and the decision is up to the individual organization or business.
I have a question.
Jeannie, yeah.
Yes, Larissa, what about, is there a provision for kids under 12 who cannot be vaccinated if they want to go to a restaurant or something like that?
Yes, great question, Jeannie. Right now, there is an exemption for kids under 12 who are ineligible for vaccination. So that's part of our recommendation that businesses include that in their policy of how they plan to approach that, of providing reasonable accommodation or requiring mask wearing by those who are ineligible. And we do have some of those nuanced questions on our website as well.
Marky.
Yes, I applaud what you've been working on, Larissa. I just came back from Austria and Germany, and you do not walk into any restaurant, any venue, any concert hall without a vaccine card. And then they give you the form for contact tracing. And therefore, their community spread is very, very low. The incidence of COVID in their countries are very, very low. And the other requirement, not only having a vaccine card, and they did check to see if I had copied my card and laminated it, but they wanted the original card. You're required to wear an FFP2 mask in all venues. So they've got it under control. And that was one of my key points I wanted to share with everyone, that this type of policy, I really think is going to help us as we go into the winter season and we welcome guests to come back in our community.
Dr. Levin.
Yeah, thanks. Also, thank you for Larissa for working on this. I just wanted to clarify again, the policy is if it's under, is it under 50, which is the substantial for 21 days, then it will, the mask, or is it under, I just wanted to clarify to everybody what removes the trigger.
Yeah, 21 consecutive days, and I think the threshold is under 50.
50 for an incident rate.
For
Okay.
incidents,
Sure.
yes.
And it has to be 21 consecutive days before it's.
Correct.
Okay, great. Thanks. Thank you.
Thank you. I just wanted to point out that what Marky was talking about is, it's fantastic. And if only we had a statewide or even a federal policy that would indicate that. I think locally we rub up against doing something like that when all of our neighboring counties even might be doing something vastly different. So it's frustrating to hear that they're doing it so well over there, and I'm not sure we can figure out how. Tori?
Thanks, Greg. I was wondering, can somebody give us a little information around of the vaccination as it relates to transmission? So my understanding, so this is, I guess, I'm asking for some clarity for me and others that think the same. My understanding is the vaccination has been most helpful for people who contract the virus to get less sick, perhaps, less hospitalization, less death rate, perhaps. But I think I've seen information over the last couple of weeks that a high percentage of our tested cases positive in our county have been amongst the vaccinated. So can somebody give me a little bit more information about how does the vaccine translate or relate to transmissibility, catching it, carrying it, and passing it on?
I can start, and then I know we've got lots of doctors and epidemiologists who can help pitch in here as well. But Tori, what we know is the vaccine, we have specific information, even from Colorado, about how effective it is against preventing an individual from becoming infected with COVID. And those rates range from about 75 to 80% and vary based on age. So it tends to be, in that range of your 75 to 80%. There's vaccine effectiveness of you not contracting the virus. Additionally, it's even more effective against preventing hospitalizations if you do contract the virus. So your question about, why in Pinken County are we seeing so many people who have been vaccinated, contracting COVID? Look at our vaccination rates. We've got, in some age groups, over 100% of folks with at least one dose of vaccine. And so we are in a very well populated, very well vaccinated community here locally. And that's why even though we are that well vaccinated, we know that the effectiveness of the vaccine, is not 100%. The more time you're being exposed to COVID, the more opportunities you have to be able to catch it and transmit it. So there are vaccine breakthrough cases. And then what we're ultimately really looking to protect here locally is our hospital capacity. So we still know that vaccine is the best tool that we have to be able to do that. Secondarily, this is why we have our masking mandate in place when transmission rates are considered substantial or high, because those that are vaccinated can still catch COVID and can still transmit it, just at a much lower rate than those that aren't vaccinated.
Thank you for that. I guess, and I'm not advocating for anything here. I just want to make sure that the decisions that we're making and the protocols that we are following are sensical and effective. So, my other questions are about, like, why I don't know, why wouldn't a negative test be also included in this program? And again, I'm not advocating for it. Like, I'm not saying, oh, but I'm just wondering, you know, are the measures that we're taking the most effective and appropriate? So I don't even need an answer to that last question. I'm just putting it out there. I want this board to make sure that we're thinking about these situations from a 360-degree view.
I've got Dr. Levin and then Dr. Kurt.
Yeah, I can just add to Jordana's responses that the vaccine is highly effective and continues to work. That 80 in preventing severe disease, hospitalization, and death. So right now, about 80% of people who are hospitalized for COVID in Colorado hospitals are unvaccinated. So of all the people hospitalized for COVID-19 in Colorado currently, 80% are not vaccinated. So it lays a lot of credibility to the vaccine and the effectiveness of it. And there's some early data that are around the same, maybe for death rates as well. So it's really highly effective in preventing severe disease and death and hospitalization. And so what we're seeing are these quote breakthrough cases where people are getting milder disease, not getting as admitted to the hospital, but there are cases now where people have been vaccinated and getting COVID-19. And that is a tribute to the high transmissibility of the Delta variant, which is pretty much 100% of what we have here. We send samples to the state and they're sequenced, and the Delta variant is not only predominant, but almost 100%. We know it's more highly transmissible. So we're up against that. And the vaccine is still doing its job, but it's the variants, I think, that are kind of tricking the vaccine at this point. But again, it's still doing its most main basic job. So that, in addition to masking, which we know is effective, those are, I also believe, the two main kind of instruments that we have against COVID-19 at this point.
Thank you, Dr. Levin. Dr. Kurt, and I see Krista has her hand up.
Yes,
Dr. Giesel.
I'm with Marky Butler with the Austrian program that you need to include face masks with the vaccination. And that has been borne out so well. I'm on the Wheeler board where that's been implemented in last Friday's John Denver tribute, where face masks were, because I was ushering there also for that program, were essentially 100% being worn. Now, I'm aware that the number of beds in Aspen Hospital have been emptied, and that's because they're not as serious cases for people who've been vaccinated. In fact, I think on the other hand, 72% of the people who've had cases in the last few weeks in Aspen have been vaccinated. So the use of face masks is very important. And I'd like to defer now to Josh Vance for the exact epistats on those figures.
Can I just make a quick comment before we go to?
Go ahead.
Yes, I just wanted to second everything I've heard so far. And I think part of the transmission we're also seeing, Tori, has to do with this high incidence rate that we still have. The more virus you're exposed to, the higher risk you are just catching it, because it is so, excuse me, contagious, as Dr. Levin said. And I do have a cold. You can actually get things that are not COVID again. The other thing I just wanted to point out, though, that I really feel like it's lost in this vaccination conversation is that we're hearing about these other things, like Merck has a new pill that's coming out, and you can go and you can get monoclonal antibody, at the hospital. But there are 68 million people in our country that are still eligible for vaccine and have not received it. And if they would receive it, we would just have decreased transmissibility of this virus everywhere, and fewer people would get it, and it would stop mutating. So vaccine remains the number one most important thing. When our incidence rates what they are, we have to mask as well. I mean, we are still at very high levels of this pandemic, in a position though that we actually have an effective way to reduce those substantially, which again, we have as a community, but we're a community that receives tourists and people fluctuate and travel all the time. So we still, in some ways, have this exposure to this outside, incidence. I blame our incidence rate in part on what's going on in the rest of our country.
Great, thank you. I don't know if we were ready. Okay, Linda, I see you. Okay, this meeting may go a little longer, folks, but that's fine with me.
I just came back from Portugal, and the same holds true for Portugal as Austria as far as, the rate of immunization there is 90% and the rest are pretty much 12 and under. But my point is that there has to be more testing and rapid testing. And I went into a restaurant with a under 12-year-old and they immediately handed him a 15-minute antigen test and needed to be tested negative before entering. And I think our restaurants and a lot of our places can do that. And it's accessible. All the pharmacies offer free testing and is free. So I think that's one of our things that are lacking in our country is free rapid testing. Thank you.
Thank you. That's the optimal situation that would be nice to reach for. Okay, Jordana, are we moving to Josh next? Is that where we are? Josh, I don't see you, but I think you're here. There we go.
Hey, Greg, thanks. Yeah, I mean, last quick comments on that. Our breakthrough rate in Pinken County is high, but we do have fewer overall cases. Our incidence is higher than we wanted, but our incidence rate is lower than almost most counties in the state right at this point. And it has actually remained lower. So while it's still high, according to the CDC threshold, it's lower than many other counties. So you have to take the breakthrough rate with that in mind as well. Last thing I'll add is in some analysis that we've done with our local data, about 70 to 75% of individuals that are unvaccinated and around somebody that has COVID, they end up going on to develop symptoms. This is in a household setting compared to only 30 to 35% of those who are vaccinated. So again, while the rate seems significantly higher, we're seeing that the household spread or really close contact spread among those who are unvaccinated is significantly higher in our county. So just wanted to add those few notes. I just have a few slides I wanted to share on some data since our indoor mask mandate in the county, and also some data on our school mask mandate, just to show the effect that masks do appear to be having in our county. So you can see on this graph here, this is looking at individuals that claimed to have been exposed in a public setting. And what you'll notice is that since August 1st, and actually goes back quite a bit longer than this, about 75 to 85% of our cases were reporting being exposed in a public setting. Since masks went into effect and their most indoor places were adhering to this at pretty high rates, we saw a fairly large and consistent drop in the percent of cases who were noted as being exposed in a public place. You can see that this is a significant finding. So that p-value on the right just shows that the data is significant. So it's not an anomaly. There is something that changed at that time frame or during that time frame, which did reduce the number of cases that were being exposed in the public setting. So while it's hard to say with 100% certainty that masks are what led to this change, the timing fits very well. Next slide. This is our 7-day incidence in Pinken County in the blue compared with the incidence in Colorado in the orange. Again, if you look at when our mask mandate went into effect, you can see a sudden drop in our incidence following the institution of the mask mandate, whereas the entire state of Colorado as a whole has not seen that kind of drop. And so, in the month and a half, 2 months prior to this mask mandate, our incidence was higher than Colorado's for most of that time period, with a few exceptions. But since about a week and a half after our mask mandate went into effect, you can see that our incidence did drop below the entire state. I will add that mobility and tourism was not associated with this decline in cases, meaning that we did not see any sort of association or correlation there with mobility in this instance. We know that mobility and tourism is closely correlated with our case counts, especially when our incidence is high. But in this case, it is not a confounding factor. So we know that that was not playing a role in why we saw a decrease in our incidence. The last thing to note here is many counties across the western part of the state saw or reported more cases last week than at any point during or any week since January. So Delta, Montrose, Mesa, San Miguel, and Garfield were reporting extremely high rates of COVID. Again, with our mask mandate in effect, knowing that there is significant numbers of individuals testing positive for COVID in the counties around us, we know that there is an effect here with our mask mandate. Next slide. So then looking at schools and what's occurred in our schools since the beginning of the school year to identify the effectiveness of mask wearing in our schools. Our data team has put together a dashboard, which is on our website, looking at cases that occur in our schools and childcare settings. And so this is one of the graphs from that site. And it looks at among the individuals that are associated with a school or childcare within Pitkin County, where did exposure occur? And so what you'll note here is that on the left-hand bar is individuals that were exposed outside of the childcare or school. So they were exposed at home or in some other setting, whereas the bar in the middle shows you the number of individuals that were exposed at a childcare or in a school setting. And we've only had a very small handful, only 4 individuals that we believe to have been exposed in the school or childcare setting within our county, compared to 32 total cases among students, teachers, and staff as of October 11th. And I'll add to that, 3 of those 4 cases were all a part of the same cluster. So really, we've only had 2 different settings where we have identified exposure having occurred within a school setting. Again, speaks to the effectiveness of mask wearing, especially when every individual is wearing masks. And last slide. And so then this very last slide here shows you in the blue, again, is Pitkin County, the green is Colorado. This is the percent of cases that are among 0 to 19-year-olds. And so if you look back into July during the summer, we had a point in time where about 40% of our cases were among that 0 to 19-year-old age group. And then it dropped off and fluctuated a bit until the school year started. So in that gold there is when the school years began to start throughout the state of Colorado. And you'll notice that there is an increase in the proportion of cases that are being identified in 0 to 19-year-olds, right in the middle of that gold box there. And then, our case rate or percent of cases among that age group actually dropped and has remained significantly lower than the entire state. Around the middle of September, most schools in Colorado had implemented a mask mandate at that point after many outbreaks and fairly large outbreaks across the state had started to be identified, especially in schools that did not have masks mandated on their districts or on their school campuses. And you can see that our rate has remained low despite many schools starting to institute these mask mandates. So again, just speaks to the extremely effective nature that we know masks have, and it's keeping our kids healthy, and it's keeping our schools open and free of the need to have to quarantine individuals in our schools. So just wanted to share that slide as well, just again to highlight just how effective we know masks have been in our county over the past 2 months. I think that's all I have, so happy to take any questions.
Josh, just as a point of reference, do you have any idea what our incidence rate was this time last year?
I can get that for you in like 30 seconds, Krista.
Okay, well, while Josh is doing that, anybody else just chime in if you want to say something.
Yeah, this is Tori. I had another question.
Yeah, sure, go ahead.
And it's for Josh. I don't know if he's listening or not, but it's just to pick up on the conversation that we were just having a second ago as it relates to the percentage of those that are hospitalized that are vaccinated versus unvaccinated. I'm wondering what that curve or graph looks like. I think when the vaccinations were started and people were double vaxxed, we were seeing very low percentages of 2 and 3% of vaccinated population being in the hospital. Jordana was referencing that it's around 80% at this time. Do we expect that to level off, keep declining? What's the trend with that statistic?
So overall, we've seen about anywhere from 1.5 to about 2% of individuals requiring hospitalization in our county since the beginning of the pandemic. And that has decreased recently. We haven't seen that ratio hold. So it has been a lower proportion of our cases that have been requiring hospitalization, particularly since the vaccines became more widely available. So, moving into the fall and winter, our data has shown that approximately 1.5 to 2% of individuals on average have been requiring hospitalization. So one or two for every 100 cases. It's hard to know what that's going to look like moving into the fall. We know that booster doses and third doses are going to have a significant impact. Getting our pediatric population vaccinated as well and preventing spread to others will have a significant impact as well. But our hospitalization rate has remained fairly low, and I suspect that ratio will remain fairly consistent moving into the fall.
Thank you.
Okay.
Chris, to answer your question, our incidence was at 84 at this time last year.
Great. All right. Let's see. Where are we going next? We're going to.
We're taking a trip into testing and vaccination updates.
Thank you.
So if we go to the next slide, can talk through Linda, really, as you pointed out, there were a lot of things in the past month and a half that were identified around testing needs as we started to see incidence rates increase. One need that came to light was that there wasn't any availability at the free community testing sites on the weekend. And so starting in September, Saturday testing was made available at the airport. Weekend testing currently also is available through Aspen COVID Test down in downtown Aspen, which can have costs associated with it, and then also at the Aspen Valley Hospital with a doctor's referral over the weekend. Linda, again, to your point of, 2 months ago, we didn't have any free rapid testing options in the community. We recognized that this was something that we needed to work on, and we were able to address it by working with Roaring Fork Valley COVID testing sites and Dr. Allen, who runs those sites behind City Hall and out at the airport. They now offer rapid tests in addition to PCR tests for symptomatic individuals. The reason why at this point rapid tests aren't being offered to everyone is we're still seeing in the data that only about 50% of those that are not symptomatic are being picked up with that rapid test. And so while rapid tests we're not, we do have a bit of a limited supply there. We wanted to use those in settings where we know they are going to be giving us the best data to be able to work off of. Additionally, the state came out with a program that allows a couple free Binax tests to be shipped directly to your door, to your house. And so we have been promoting that within the community. Additionally, we've been working with all of our schools to have access to rapid tests, both a rapid antigen test, which is that Binax test, as well as a rapid PCR test, which the one we have is called a Q test. And schools have been developing protocols to be able to use those within their own school settings for individuals who may develop symptoms throughout the day, to be able to have that access right there, point in time. Additionally, and the need for free community testing for kids who are too young to spit was identified. So those microgen tests, which are the send away PCR tests, you have to spit into a little bit of into a tube. That spit gets analyzed. So for kids who weren't able to do that, just this week, cheek swabs are now available at those testing sites behind City Hall and at the airport for children too young to spit. And then also if those young children have symptoms, they can get a rapid test as well at those sites. We do want to reiterate that parents are responsible for collecting those samples, and we have provided instructions, written instructions to those sites for how to just swab either the nasal and do a nasal swab or a cheek swab. Finally, it was identified that there was a lack of point of care testing at medical provider offices. And so as the state was pushing out this availability of those Q or Binax tests to us, we were in turn offering that out to medical providers who wanted to be able to offer those tests in their own office settings. Those tests need to be offered for free to patients. We get them for free, we give them to providers for free. And so any provider who wants to continue, who wants to offer that, we're happy to work with them to figure out what the best test is for their in-office situation. Next slide, please. While we have done a lot of work around making testing more available in the community, we know that there's still some areas to work on. One is the promotion and communication of this increased amount and type of testing, and clarification of what's available where, what are the requirements, to continue to expand that point of care testing for medical providers, and also to look into additional rapid PCR testing options that could be available to the community at no cost. Here are just, this is the website where all of this information is available. And if you're interested in signing up for CDPHE's Rapid at-Home Testing Program, we've got a link there. And then also just to reiterate the hours that are currently available with those free community testing sites. Behind City Hall, it's 9 a.m. to 1:30 p.m. Monday through Friday. Aspen Airport cell phone lot is 7:30 a.m. to 11:30 Monday through Saturday. And that microgen spit test is available for everyone. And if you are symptomatic, you can get a rapid antigen test. That's it for testing. If there's no questions, I'll turn it over to Carly to start talking through vaccination if her connection to the internet is good enough. If not, I can keep talking through that. Oh, and I don't see Carly on anymore, so I will keep talking. Dr. Kurt.
Great, thanks.
Yes, I'll point out that the Abbott Binax test, while very helpful in immediately doing a diagnosis, is not valid for airlines or travel. The microgen test is the standard for that. The PCR test.
Okay. So next slide, please. So we'll be talking just about the recent updates that have been going on with vaccination around third dose eligibility, eligibility for those 5 to 11. And then just want to reiterate also the importance of getting a flu shot this year. Flu shots are out there, available. There's concern, I think we talked about this last meeting, concern that flu is going to be a worse season this year than we've seen in recent past. So continuing to encourage that in the community. And when we get to our comms section, they'll give you an update on the flu campaign that's being developed locally. And then as you're, for individuals who may be watching this, who are thinking about where do I get vaccinated, there are additional doctor's offices that are coming online to be able to offer COVID vaccinations as well as flu vaccinations. So check with your doctor. And then we always have our pharmacy partners and vaccination clinics, more of which information is available on the website. Next slide, please. Okay, so current approval for and boosters. The highlight here is individuals seeking a booster dose currently must receive the same vaccine they received for their initial dose regime. For Pfizer, we know that that is fully FDA approved. The EUA approval is for anyone that is 12 years of age and older. The EUA also, there is an approval for boosters with those that meet those following 4 conditions there. For Johnson & Johnson, we currently have EUA approval for those that are 18 years of age and older. And at this point, boosters have not been approved. Moderna has currently an EUA approval for those 18 years of age and older, and an EUA approval for boosters, but only for immunocompromised individuals. Moving on to the next slide. Just so that this Board of Health really has an understanding of what the process is. We know that there are a lot of upcoming dates and hearings, and wanted to give you a little bit of insight into what those are and what the process is. So the first step is that the company submitting additional approvals would submit data and requests from the FDA. The next step is that the FDA then sets the hearing date to discuss the data, the efficacy, and the safety. Step 3, if the FDA does approve it at that point, it goes to the CDC for Advisory Committee on Vaccine Practices, ACIP, approval to be able to set how the vaccine can be administered by providers. And then 4th step is that ACIP guidance ACIP guidelines are released to providers, and appointments can be made which follow the ACIP requirements. So with all of these dates that are coming up, that's the process that we need to wait for to happen before we can begin giving those additional doses or to additional populations. Just some upcoming dates to be aware of. The 14th, today, is the Moderna booster FDA hearing. The 15th, tomorrow, is Johnson & Johnson booster FDA hearing. Shortly following, on the 20th and 21st, are the CDC ACIP hearing on Moderna and J&J boosters. And then the 26th, towards the end of the month, this is when we're getting that Pfizer presenting their hearing to with the FDA for 5 to 11-year-olds to be able to receive vaccinations. They have also set the date for that CDC ACIP hearing for Pfizer for the 5 to 11-year-olds for November 1st and 2nd. So a lot of activity happening in the next 2 weeks here. Next slide, please. Any questions before I turn it over to our comms team?
Jordana, Greg here. Somebody, who is that? Krista?
You go first.
Okay. Only that listening to the radio this morning, there was discussion that studies have been done with the J&J vaccine and how people they're starting to advocate getting say a Pfizer booster on the J&J vaccine. There's talk about this, and so that's not what's coming down through the CDC, which is, I understand, where the protocols that we follow. But I was just wondering if any of the physicians wanted to weigh in on what's happening out in the rest of the world. And maybe you don't, but I just, the thing is, there's a cognitive dissonance there, because sometimes you're hearing something that sounds so different coming from the CDC official protocol versus what's happening in the real world, in the trenches, so to speak. And I don't know if anybody wants to give us a quick background on that, or if it would be helpful. But I just wanted to point that out, that sometimes what we hear on NPR is almost contrary to what we're hearing coming through the pipeline from you via CDC. So do what you will with that, folks. All right, Dr. Kurt.
As of this morning, I read in AP News that the FDA panel has approved giving the Moderna vaccine as a booster in 1/2 the usual dose. So Moderna has been shown generally to offer better protection than the Pfizer vaccine. And I would suggest that people look into this, as well as having a flu shot may possibly have a synergistic immune effect. It has not been proven with the RNA vaccines, but with the DNA vaccines, it has been shown that having 2 vaccinations either at the same time or spaced 2 weeks or longer may have a synergistic effect.
Greg, I
Right, thank
haven't
you.
looked at the actual studies yet, haven't had a chance, but it seems that if you get one vaccine and then a different vaccine, you actually have more neutralizing antibodies. But the study was pretty small, about 200 people. So I will have to go look at it. And also the data for J&J shows that if you do get a booster, even with J&J, you get a very, very strong immune response.
Thank you for that. Okay. All right. Back on track here, Jordana. Are we ready for
Can I just
while we're
ask
talking
one
about
question to
communications?
Jordana based on
sure.
that last? So it
Yeah,
looks
go ahead,
like the
Krista.
kids won't have access to the vaccines between 5 and 11 until after November 2nd. Is that true based on what you just showed us?
Yes, and we've got some planning in the works to be able to have clinics be ready that first week in November, and are also, got to finish sending the email, but also there was the idea to start planning outreach to parents before that time. So knowing that, parents might have questions, it's, your provider is a great person to go and ask, but especially for those individuals who may not have a medical home, wanted to make sure that resource was available in the community.
Marky.
Yeah, this question is for Jordana or for Carly. This morning, I thought I'd go ahead and try to get my booster since I'm over 65. Just so you all know, I'm over 65. And I called over to Community Health Service. They are not giving the booster. So then when I went on the website, it appears that there's only one location per week. And the next one is at the St. Regis. So is that correct? Or is there any other place where we can get a booster?
You can get them at City Market Pharmacy. I saw lots of people getting boosters when I got my flu shot.
Okay.
You just have to go online.
Is that eligible?
Also Clark's and Eligible or Aspen City Market.
So they will do the boosters there. Okay.
I got mine Saturday morning.
So you're over 65 too.
Oh, I shouldn't have said anything. No, just kidding. No, but just be prepared. It's I had quite the reaction to it. So.
Okie dokie, thanks.
Well, and Marky, I'll tag on. I wish Carly was here and maybe Jordana remembers, but the state Vax bus is coming to Pinken County again and going to be in our community for several days. And Jordana, I don't remember if additional doses were going to be included potentially. I think they are. So that's another thing to look for. And that'll be passed through. Those dates will be passed through on our information.
That's wonderful, Tracy. Thank you.
And just real quick, Marky. You do have to make an appointment. And it's very easy. Just go online, search City Market vaccine, but they don't take walk-ins anymore.
Yeah, when I filled out all the data and the form to fill out to get your booster, like a St. Regis or in Snowmass was yesterday, that's a lengthy form. And I had to email or upload my insurance information. I'm going, whoa, this is different than the first 2 doses of vaccine.
You don't have to do all that. Yeah.
Oh, I'm loving this. I'm glad you all got me informed and up to date.
Take you about 2 minutes to fill out the form to make the
Okay,
appointment.
guess what I'm doing? I'm going to cancel that appointment.
Okay.
The state vaccination mobile clinics that'll be at Ruby Park and I think in Snowmass again also are, it's actually an easier form I thought than City Markets. I kept getting kicked out of the City Market one. So there are options out there, so stay with it. Okay, where are we now?
Over 65. Greg.
I'm not saying anything.
We have to have fun with this, guys.
Okay, are we ready for Tracy Truelove? I see she's here. Is she our person on deck?
I am your person on deck, and Marky just gave me the perfect lead into the first slide that we have, which is what we tackled for a flu campaign. So we were thinking about how people are just kind of tired about talking about COVID. We know flu's been around a long time, but how do we get people to engage with the conversation, recognizing it could be a bad flu season? So we decided to do a little bit of, I don't know if humor is the right word, but personify flu. So our team will be rolling this campaign out, which is kind of just how you continue to do those public health best practices with anything, flu included. So you're going to start to see this in print and in our digital media. The idea that, to still protect yourself at the grocery store, when you're on an airplane, just again, using the healthy best practices to continue to stay healthy. And, we recognize there's a lot of conversation around hospitalization capacity for us. And so it's, again, we're really going to push that flu message. Also, the fact that you can get the flu vaccine at the same time you get the COVID, either additional dose, or if you're getting the first rounds of the COVID vaccine. Most of the medical providers we've spoken to have said that is something that's possible to do. So Carly is out there getting us vaccinated all over the place, but this is our campaign for flu that you'll see this year. Go ahead and next slide, please. Just wanted to touch a little bit on what we've been up to. So a lot of the progress we've made as a communications team is the fully vaccinated facility and event program, as well as the mask mandate program that, rolled out from the last Board of Health meeting. We also are working closely with Carly and her team on the vaccine card, web search tools. So we recognize that to go into this additional dose conversation, people have to have their medical records pretty well organized. And we know some folks are like, what did I do with that white card? What did I, where did things go? And so we've got a tool that can help people understand how they can get reconnected that information if they've lost it. That's also on our website. It's kind of one of those things like, if you still have your card, click here. And if you do, it takes you to the next step of what you would need to do or not do to check that you're in the SIS system and the state system. And of course, our data summary continues to be a very robust email that you get if you've signed up for our newsletters, and just seems to be something that people are very drawn to opening and engaging with. Next slide, and I'll talk about what we're going to continue to do with that data summary. We are working with the Aspen Daily News and Aspen Times to now get the data summary weekly posted in each of the papers. So Kara Sibolnaga did a great job of getting us some more grant funded money for some of our communications. And we're going to use that for co-oping some advertising with them, so that if you're not signed up for our newsletter, you'd see it in the paper weekly. And I believe in talking to both papers, you'll probably see that roll on Fridays. That summary typically comes out on Thursday. And so you'll probably see it printed in the paper on Friday. Of course, we're going to be working on getting a lot more information out about the state VaxBus being here and people engaging with that. And then we recognize that we're back in that holiday season and people still have questions, but I think you'll see that our team will keep driving folks to the healthy best practices conversation. Next slide. Just a quick update again on our webpage. Continues to be a place where we see a lot of information, people going there, especially when we see case counts growing. That really hasn't changed much. Also see a great deal of readership of that weekly data summary that's coming out on Thursdays. And then we've had over 800 page views just in the month of September for our Spanish pages. And again, we have that call center and that's, bilingual call center with our teammate, Rosa, answering those calls. And I've never seen somebody, again, work harder to try to make sure people are getting the answers to the questions that they have. And then I would be remiss, and I know we're going fast, but we didn't get a chance to talk about it last time, but if you'll pull up the next slide. Our team was a finalist for what's called the Center for Digital Government Experience Award, and it was for our COVID-19 website. And I think what's pretty phenomenal about this is that we were a finalist with 4 other counties, all of over 500,000 people or bigger. And the winner ended up being LA County, which is, 10 million people or more. They have a lot of resources available, but it was, I think it's just important to recognize there's a really dedicated team of, we've got folks that are interning. You've got some of us that are still, on board with you and have been since March 8th when this all kicked off. And it just continue to do really good work. And that site is going to continue to be our workhorse of a place to go to get information. And if it's confusing in any way, then calling us is the other option. And again, we are moving our comms to recognize that we can't eradicate COVID, or we're not in that space now. We're just all trying to figure out how to continue living with it. One other thing I'll share is that we have a highly engaged group of community communications professionals. So City of Aspen, the tourism folks, Virginia and Eliza, Sandy Dilber from the City of Aspen, doing a lot of cooperative communications together, which I think has been such a great outcome for, just our community, that we're all working together, collaborating. The city has got a banner up over the over 82, with the mask mandate information, and the kiosk has been updated with some COVID communications as well. So everything public health keeps bringing at us, Jordana, we keep trying to turn around and put out good information and connect people to what they need. So I think that's the last slide I have, but any questions or feedback, I'm happy to take that.
Thank you, Tracy. That's great. Congratulations to everyone involved in the website. I did not know about this, and it's great to be recognized for your good work, especially when you're up against such massive communities with, as you say, the resources they have. So to be in the top 4, is that right? Is that what you said?
Yeah, there were
five
five counties,
wow.
And we were
Fantastic.
one of them. And like I said, everybody was a lot bigger than we are. So good news.
That's great. I did have one question just regarding our outreach, and I was going to propose it after our discussion at the county commissioner meeting last week with ACRA. As we are reaching out to visitors coming to Aspen and the Valley and Snowmass Village this winter, what are we going to be telling them as they come regarding the appropriateness and the additional benefit they get from arriving vaccinated? I would love to have a campaign about, arrive vaccinated and live life even more fully, and enjoy it more. And I'm hoping we can do something like that. So we're reaching out to people coming here so they know what we would like and expect and what we can offer them for arriving in the safest state they can.
We had a great meeting with that community communications team, and Virginia McNillis had shared with us, that outside of the communication that maybe a lodge sends directly because somebody's booked directly through them, a lot of people book through other places. And so we were talking about potentially when people, like you say, when people get here, how do we maybe pass our message on? Or it's more that point of contact kind of messaging. And so we're going to dig a little bit deeper. We also had a lot of great work come out of what we called our Healthy Winters last year. The message is still very adequate for this year. And we're talking about how we kind of dust that off, but also just, keeping it simple right now with the mask. You're expected to wear a mask when you're here. And I think you're going to go into this next piece with a much more robust conversation after it about the winter plan, but I think there'll be a lot of communications initiatives that come from that.
Great, thank you. With that, we're going to segue if it's time. Did I have a question there from anyone? Oh, okay, Jordana, you're back, and maybe Dave Ressler is here as well. Haven't seen him on the list, but maybe he's with us.
Yeah, Dave is stepping out of another meeting and will be joining us here in a little bit. So we just go to the next slide. I'll get us started in just framing up the conversation of planning for winter. So this really came about when the community has been asking us for the most predictability as possible of mitigation measures. What can they expect going into winter? If things get worse, what are the triggers? What would the mitigation strategies be? And how can they be planning for that? As we look at the proposed triggers and mitigation strategies, you'll realize that we're really managing the hospital capacity. So with the shift that we made, several months ago was to really look to assure that what we're doing here and the measures that we're putting in place are tied back to the very important goal of ensuring that our hospital has the capacity not only to take care of those who might need care due to COVID, but from having an accident on the mountain or having another medical event. And so you will see that in these measures that's really what those triggers are based on as we're really focusing there as we move forward. As we look at these winter planning strategies and tools, I think the point that has been well talked about today is that, we have tools this winter that we didn't have last winter. Vaccination is widespread. Booster availability is coming out. Either it exists or additional booster capacity is coming out very shortly. And we know that this is going to be an incredibly important tool, not only to promote with our local population who's living here, but for those that are coming to visit. Finally, this proposed trigger and mitigation plan that I'll present today really represents many conversations that have been had with Aspen Valley Hospital and the winter planning group. That winter planning group includes representation from the different municipalities in Pinken County, ACRA, Go Snowmass, Ski Cove, RASTA. There are other folks on the in that group as well, but it's a pretty broad coalition who are all really have the same goal of how can we have a successful winter where we are able to keep transmission of this virus down, protect our hospital capacity, and stay open to keep that economy open and running. So if we look at the next slide, we'll see that the first mitigation strategy is what we already have in place. So the indoor masking order, with that exception for 100% vaccination verified businesses, doesn't have an expiration date at this point. So if we continue to be in substantial or high transmission, that will continue to exist as a mitigation strategy. If we fall back to lower moderate transmission for 21 days, that indoor masking requirement releases. What would be new are these proposals that the first section of which are time bound. So really thinking about the trigger as time bound one coming December 1st, ending May 1st for our winter season. We know that this time period is associated with an increase in travelers, an increase in mobility, increase in folks in town, and what are the things that we can know that we can put in place already. So these proposals have been, one, bringing back the event safety plan as a requirement for all events with 50 or more people. The event safety plan is currently only required for events that require a special events permit from any city or any municipality or the county. But we've really found that the event safety plan provided a lot of information on those mitigation strategies, on the different things to think through based on the size and type of your event, and giving some information on those layered effects of those mitigation strategies, of which we saw a lot of folks moving this summer to either requiring vaccination or a negative test to enter, and how are all events really thinking through the current landscape and what works best for their event. Us having the staff to be able to review that and reach out to those if they aren't able to be just approved right away, and work through what would be a sufficient event safety plan. The second strategy here is bringing back the Traveler Responsibility Code. The purpose of this, last year, you'll all remember we started with the Traveler Affidavit, which required an attestation to having taken a negative test before arriving, and shifted by the end of the winter to this Traveler Responsibility Code, which was more of an educational tool. That really laid out what are the expectations when you come to Pinken County, what are the current requirements, and Greg, I think this is a little bit of your idea. What are we asking when you come, for you to know and for you to be able to comply with what we've got in place here. We felt that we heard feedback that the responsibility code was really beneficial for those to learn about what those rules were before coming to Pinken County, so that it took some pressure off of those frontline employees, so that the hospitality associated business sent this out to you before you came to town, And it wasn't that frontline hotel worker or somebody selling you a ticket at the gondola who was the first one to notify you of what's required in Pitkin County. And so we really see this as a way to help reduce the impact to those frontline employees. Thirdly, updating the business playbook. We currently have a 2021 business playbook, but we have a whole lot more information we think we can update there for businesses to start thinking about mitigation measures that might be appropriate for winter, as well as additional vaccination policy considerations that weren't really being, weren't being discussed last year for the winter. So those are the proposals for those time-bound proposals. These next two triggers you'll see have more to do with hospital capacity. And I'll talk through the triggers and strategies and then turn it over to Dave just to talk a little bit more about those triggers and what goes into them. So the first is if the hospital does suspend elective surgeries, the mitigation strategy associated there would be a 50% capacity indoors or that 100% vaccination verification requirement. This would not include schools at that point in time, and there would be additional event restrictions applied accordingly. I think I'll let Dave talk about the real severity of that trigger. If we're to that point where the hospital is making that decision, there are some measures that we feel like the community needs to take to be able to continue to protect hospital capacity at that point in time. The final trigger is, another step even further down the line of threatened hospital capacity. If the hospital has to move to crisis standards of care, then this is the point at which the Board of Health would be making decisions around implementing a stay-at-home order, ordering all travelers to return home, only allowing essential businesses to operate, really looking at just that gathering size being household only, and even schools going remote. If we're at this point, we can't transfer folks, we can't take care of everyone who needs care to the degree that we'd like, and that is the point at which those measures would be really would be required. Those much more severe mitigation measures at that point in time. So Greg, if it's all right, I'll turn it over to Dave.
Yep, great. Thanks, Dave.
Good afternoon. Thanks, Jordana. And let me first say that Jordana's representation is very fair, that we have had numerous conversations about how to balance the importance of not overwhelming the hospital and its capability to serve not just COVID patients, but all patients, with maintaining our services in the community and our economy. So I think this is a good trigger, and we arrived upon this through a lot of conversation, and ultimately it stemmed from the hospital describing what happens inside our facility when we start becoming stressed. And I'd like to pause on that for just a second and talk about the matrix, the hospital capacity matrix that we have been maintaining on the website, Pitkin County website, as an indicator to the community of when we are stressed. And we talked about the fact that that matrix in and of itself is not necessarily a good trigger. It can be, but that it has a considerable amount of variability built into it because we're such a small facility. And ultimately, we agreed that we will maintain that matrix and indicate when we're feeling stressed, such as when we moved to caution a few weeks ago. But the fact is we have a fair amount of flexibility, and it can change pretty quickly with patients arriving or leaving or volumes going up or down, again, because of the size of our hospital. So it's very difficult for us to use empirical measures like
75% of our capacity in the intensive care unit is occupied, because we have the ability to transfer patients in and out of that unit and have operational decisions around what's best for each patient that can impact that number. So instead, we talked about what are the realities that the hospital is facing when we're stressed, and how will we know when we really are starting to have compromised ability to take care of our patients in our community. And that was where we explained and described what it looks like when we have to decide to suspend or cancel elective surgeries. That is something I've only had to do once in my career, and that was in March of 2020, when we were in the midst of the pandemic, and we actually suspended all elective services at the time. Many of you may remember that. Doctor's office visits, imaging, et cetera, lab draws, not just surgeries. And that was also because we were trying to maintain a safe environment and not have unnecessary traffic through the hospital from individuals, while we really didn't know at the time what, how to protect against the spread of COVID. Well, now, if we have to go there again, it really will involve just surgeries, because if they're elective, what that means is they don't have to have that surgery. The patient might be choosing to have a hip replacement or something that can wait. And that's what we consider to be elective or non-urgent or emergent. And they can wait. However, having said that, as simple as that sounds, these are a major source of the hospital's revenues and our economic viability. So when we decide to suspend elective services or elective surgeries, it is a major decision. As I said, I've only had to be involved in making that decision once in 30 years. So it is not something that will come lightly or readily. But I'm sure you've read in the news, it's happening to hospitals, or had happened to hospitals even recently across the country, that were in communities that were being greatly impacted by the COVID virus, like in the Southeast in particular. So when we get to that point, if we get to that point, hopefully we never will, it will be a very clear signal, and it is an appropriate trigger that the hospital's in trouble. And we are doubting our capacity to continue to care for COVID and other patients with emergency needs. So hopefully that, Jordana, is helpful to explain our conversation and why that trigger makes a lot of sense.
Thanks, Dave. And with this matrix, we're really trying to do our best to give the community, and the Board of Health and all of our businesses here, the playbook by which we would be thinking about the necessity to enact additional mitigation strategies. But just want to also, mention the caveat that we all know so well about COVID is that, at any point, the state or federal government could enact measures that we might have to follow, that are different than what we've laid out here. The assumptions that we've been making on what we know about COVID thus far could change. If there's, heaven forbid, a variant that eludes the vaccine, that would require us to be thinking about things a little bit differently. But just that if things are, in the state of what we know to be true today, we want to be able to lay out for the community, what are the expectations that they can go into the winter with and plan around. If we go to the next slide, I can just, I'll get through all these slides and then open it back up. Greg, push it over to you for some discussion. So this is the hospital capacity matrix that Dave described that will still be making available on the website so that the community can have access to understanding capacity and the stress that the hospital may or may not be feeling. We've also updated this bottom data point to have, in addition to, you can see the little tab here is our RETAC hospital occupancy for ICU and hospital and acute bed use. We've also added what this capacity is across the state, which we've found to be even more correlated with how difficult it is for AVH to transfer folks, because they're transferring them really to either the Front Range or the Grand Junction area. So that is something that's new, and we feel like will help everyone understand where we're at. The last slide, or the next slide, is really for Kara to be able to talk through, if she's on the line here, about what the public process and next steps would be before we bring back a final recommendation to the board in November.
Thanks, Jordana. Yeah, so what we've proposed for the public process is obviously the discussion here with the Board of Health today. And then following this meeting, we are going to post up a copy of the draft matrix that Jordana just walked through with all of you up onto both our COVID-19 website and we'll have a big button on the main homepage that will take people directly to a form to provide that public comment. In addition, that form will be open for 2 weeks until October 31st or November 1st that morning, realistically. And then at the same time, we'll be working, the communications team and the community liaison team will be working with the sector group task force meetings with our partners at the chamber and some of the other groups that have come together over the course of COVID to solicit their feedback and give some opportunities for conversation and discussion. And then we will compile all of the written public comment, as well as synthesize the feedback from those task force meetings into a packet that will be available for Board of Health in advance of the next Board of Health on November 10th, but as well as published to the website for the public to review those comments at the same time. So that's the process for getting some feedback from the community, as well as sharing that feedback publicly with all of you and the public for your consideration at the next meeting.
So Kara, just to be clear about that, we've got till October 31st, I see, to be collecting public comment, and I think comment from this board as well, because if anybody's like me, they'll cogitate on this for a while before they have something to add. So we've got about to the end of the month, correct?
Correct.
Great, thank you. Is that it for you? It is, okay.
That's it for the presentation, Greg. Yep. And so if there's any feedback from the board at this point, I don't know if we want to go back a couple slides to the proposed trigger and mitigation measures. And Greg, it's your decision if we're able to receive any of that feedback now to be able to start that process.
I would certainly love to invite the board to certainly begin thinking about this, or if you have ideas on it and you want to share some now. I just wanted to say, it does seem like we do have a little bit of time. It doesn't have to happen today, but it certainly should begin. And yeah, as I said earlier, as we push out this traveler responsibility code, I don't know how it's going to get pushed out to the world at large. Hopefully it'll get to people before they choose to travel to the Valley. And if they do, I hope it includes some marketing, ideally with some incentives about arriving vaccinated, and perhaps, just if they had a list of the various venues they won't be able to go to easily unless they're vaccinated, might be very helpful. So I'm hoping it includes that, and I'm going to assume we've got the Brain Trust working on that now. But that's my 2 cents worth regarding the traveler responsibility code, and I'm hoping that it's going to be ubiquitously sent out by anybody booking a hotel room for a traveler coming to this Valley. I'm going to look for people, if anybody has hands up. Anne?
Yeah, and kind of a follow-up. Sorry, it's getting noisy here. I think they're starting cocktail hour. But how, Jordana, Do you have a plan for how you're going to distribute the responsibility code? Because as great as it is, I think it's a great idea. The biggest complaint last winter was, how is this getting out there? And beyond just the lodge's responsibility. And do you have that mapped out yet, or is that in the works?
So that'll be part of those conversations with the sector group. So we'll have a hospitality group, and ACRA's been a part of this conversation thus far. And we'll be inviting, what's the best way. So last year, it was a part of the public health order that required anyone who was interacting with travelers to be able to push this out to them. So it wasn't just the lodges, it was, anyone running tours or STICO or, anything if your market was mainly visitors. And we felt like that was in addition to the channels that we have in pushing it out with comms, another way to get it directly to those folks that we know are coming to the community.
And I guess I was talking when it was first rolled out, it was a bit confusing how we were getting it out there. So we can look forward to November 10th, that meeting. A better idea of how it'll be rolled out. Okay, thank you.
Dr. Kurt, and then Linda.
Yes, I've made a few notes that I would like to emphasize. Thanksgiving is really the critical time for us to assess because the winter visitors are starting to come at that point. So at Thanksgiving, we should take a look. Has the Delta variant really declined? In our epidemiologic factors through Josh Vance showing a marked improvement so that we will be ready for the winter. And secondly, have boosters, which are now being approved. Is there a great compliance in the boosters? Can we take a look at Thanksgiving, how compliance to boosters really exists? And we have some hope then of continued improved immunity in the community, as well as the visitors. Next, I think we should be cheerleaders for the visitors, not just put some humdrum announcements out, but take a cheerleader kind of approach, cheerleaders for health. We want to really reach the visitors at the airport, as well as the FBO or the fixed base operators for the Gulf streams that are flying in. So they don't think that because they're in a Gulf stream that they are immune from all face masks, et cetera. We need to reach all of the visitors at the airport, the FBO operators, as well as the terminal building. And we should try to reach these homes that are being rented out as well. People who are coming in for 2 weeks, a month through Freya's properties and others, and try to reach Airbnb. On our street, we have 2 Airbnb homes. And I can tell you from last winter, the people in those homes are walking up and down the street and relatively uninformed about what the city of Aspen and Pinken County were really doing. So we should try to really be cheerleaders and reach that population of visitors. And I consider perhaps we need to have an extra meeting just after Thanksgiving to see what has happened at that point. Either have the December meeting a week earlier for the first Thursday, or have a meeting in between to really take a look at what has been happening so we'll be ready for the Christmas group that comes.
Thank you, Dr. Kurt. I think those are interesting suggestions, and a meeting after, depending on how much information we actually have after Thanksgiving, Jordana can work on the timing of that meeting. But your points are well taken, and I'm with you on the marketing outreach, and I think we could do this to make it fun and appealing, and it could be an interesting marketing effort. And I'll help however I can, but I know we have people who actually are paid to do that. Okay, did I see Linda, you had your hand up.
Yes, I was wondering with the mitigation strategy, Jordana, and showing proof of vaccine, if proof of identity could be added to that, because there is some fraudulent activity going on with unvaccinated people showing vaccination cards, unfortunately, that they get their hands on and are showing proof of vaccination when it's not their vaccination.
If I could jump in
Yeah.
just to say, I'm aware of there is an FBI bulletin that addresses that issue, and we've distributed copies of it, and it's the sort of thing you could hang in a restaurant or in a nightclub or anywhere that just talks about the consequences of cheating on that. And you know, it's a stick rather than a carrot, but I'm with you. I think that people should be aware of the consequences.
Thanks, Linda. And we'll hopefully have some more information to share about if there are any apps that can help meet that need as well, that actually verify, you know, a person's status with the immunization databases that are housed within each different state. So hopefully we'll have more information on that come November. And I think this is just a good time to plug everyone who may be watching this to assure that your information is up to date in SIS. We have put out some communications around that, how you can do that, what the steps are to take, because if we are going to be moving into this area where we're really verifying your vaccination status, it's got to be accurate in the state's database to be able to do that.
Okay, questions, comments, Tori?
Thanks, Greg. The first thing I want to say is I so appreciate you rolling this out this way and putting it out there for discussion, consternation, and public input. I think you deserve a lot of credit for having that foresight to use this as a process. So first of all, really well done. When it comes to the actual schedule, if you will, that you shared with us, I guess I do have a couple of questions. I guess for me personally, I would probably prefer to see this as just that a schedule of trigger points and measures, not necessarily just a few that are bullet pointed and set the way that they are, but really just showing that this is kind of, if we head in a certain direction, these are the kind of measures that would come back in. I'd probably rather see it like that. My concern on the chart that you showed us was, I guess, mostly about the third tier there about elective surgeries being the trigger for capacity issues or reductions. I'm not so sure that I see that correlation as being the best metric for the best measure. There could be other factors that come into the curtailing of elective surgeries, staffing issues, and the like. So I don't know that one necessarily lines up for me that well. And then my other question or considerations would be about the ski industry and where are they going to be? Is that going to be regulated on a state basis, on an industry basis? Are they, you know, how will that work in? And then again, when we talk about your fourth level of measures, has the airline, where would the airlines be during that period? What would their stance be about travel and things like that? So number one, kudos. I look forward to the process of this. I do have some questions and maybe a reservation or two about what you've shared here, but I look forward to hearing public input and having this discussion over this month and at our next meeting.
Great, thanks, Tori. All right, anything else on these topics here? It'd be great to hear everybody's perspective on this as you're thinking about it going toward the end of the month. If there's anything else for round robin, I did have one thing I wanted to bring up.
Greg?
Oh, sure, go ahead.
Before we leave this, I'm just wondering if Dave, since we've got Dave here, you know, that this conversation about the hospital metric, and what it really takes to cancel those elective surgeries. You know, we've had this discussion in other forums. Dave, if you're just really willing to share, you know, how we talked about, you know, if this is not being impacted by COVID, and, you know, if it's other things that would be taken into consideration, or just kind of rehashing those conversations we've had to let the board know how those concerns that have been brought up in the past have been addressed.
Thanks, Jordana. I was actually trying to figure out how to raise my hand when you spoke up. So yeah, I do appreciate the opportunity to respond to Mayor Tory's good question. It's not, this is new territory for us. And so we're trying to come up with what we really believe are the best metrics to use. Obviously, we've never been through this before, but I can tell you that on behalf of the hospital and our physicians in the advisory group, and through our conversations with Jordana and her team, we really do believe that this measure of having to suspend elective surgeries is as good as we can come up with. It's we're in an environment, as I've already commented on, where it's very difficult to have empirical statistical triggers because of the high degree of variability associated with small numbers. And Mayor Tory, if it helps, the reason that elective surgeries really makes sense to be that indicator of just how concerned we are about not being able to take care of patients in our community. There really isn't any other reason why we would suspend those. We're all having staffing challenges. I'm in a meeting right now that I stepped out of, and workforce is the number one topic. Yes, it's true. We're all having those challenges. But for any hospital, not just Aspen Valley Hospital, to suspend elective surgeries, that's literally choking the oxygen to our organization. That's how we are able to maintain our viability, is by providing those services. So when we have to make such a drastic decision, it literally means having to suspend our revenue sources and draw down our cash, because that's frankly where almost all of our margin comes from. So I can assure this group and the community that if we do end up making that decision, as other hospitals across the country have, and as we made previously, it will be because of the demand on services and having to make sure that we're able to take care of the patients that present with COVID. What do surgeries have to do with taking care of COVID patients? They do consume significant resources in the hospital, and many of those patients end up at least having to have a bed available after the surgery. And so it's the first place we look to be able to stem admissions that don't need to be here, and to not have our resources diverted to something that can wait. Obviously, if a patient has an emergency surgery like a gallbladder or appendectomy or what have you, or if they're in a trauma, we're going to take care of those because patients can't wait. They need those services. So hopefully that gives you a little bit better of an understanding, Mayor Tory, about the relationship between the status of our COVID transmission in the community and number of patients requiring services at the hospital, and when we need to take more or ask the county public health and yourselves to take more definitive action to stem that demand and slow the transmission, because literally at that point the hospital would be jeopardizing our ability to take care of patients.
Thank you, Dave. I appreciate that. Looking for further questions. We're going to wrap this up. Some of us have meetings beginning at 3:30, including me. So I want to keep us moving. Dr. Kurt?
I'd like to give a quick compliment to Nan Sunding, who's just announced her retirement. She's been a great service for decades to the county, and perhaps we could officially announce our compliments to her and her service.
Thank you for that suggestion. That's a great idea. And I'd like to do something formally. Maybe we can come up with something by the next meeting, because I think she's with us till the end of the year. We have a little time to prepare for her departure, but I agree. I'm a little bit heartbroken that she's leaving, but she's been here a long time and she's done such a great job. So whoever steps into her shoes is going to have a lot of work to do.
Greg, just
Ann.
to add on to that, she essentially was our public health director for all those years until we formed this new Board of Health. So thank you, Dr. Kurt. That's a really good idea. If we could do something official to honor her and thank her for all her service.
And Greg, perhaps we could put a trigger on that chart that makes her have to stay with us.
I was thinking that she should really need our permission before she can just leave like that. I was going to say the same Cara I think is on also, and I want to just point that out to Cara as well. Okay, thank you. Our next meeting date, I see we have Thursday, November 11th would be the date, but that is Veterans Day. There's a proposal for Wednesday, the 10th. I don't think that's going to work for me because I think I have a BOCC meeting that day, if that's the second Wednesday. So I'm out on that day. I would just assume, I was in the RAFTA meeting this morning with Tori, and they decided they're going to go ahead and have it on Veterans Day. The veterans on the RAFTA board agreed that that was okay. I don't know if our veterans today would agree, but Dr. Kurt, I know you're a veteran. What do you think about having this next meeting on Veterans Day? Anybody else who wants to chime in can.
I say jump forward a week closer to Thanksgiving and we'll have more epidemiologic information to work with.
So you'd like to have it later, like the 17th, something like that?
Oh.
Or the 18th, is that a possibility? You're talking about
I think he was
Thursday?
saying go the other way.
Go the other way. Oh, well, that's only November. That'll be November 3rd then. So it's far in advance of Thanksgiving, but you're thinking about the Halloween bump.
Right.
We haven't discussed the Halloween surge yet. Not sure what that means for us all. But wear masks on Halloween. I can ask you to do that. Okay.
Greg, yeah. I'm the same as you on that Wednesday. I have a 3 p.m. So on that Wednesday, I have a 3 p.m. So I don't know if I'm available on the Thursday, but all respect to Veterans Day, whatever you want to do around that, I appreciate, but I am available.
Okay, well, we've had a chance to talk about it here. Stay tuned, everybody. Giordano and/or I will get back to you. How's that? Does that sound good? Anything else? Any other matters of business to discuss? Thank you all for being here and hanging in there. Thank you to our audience, our anonymous audience out in the Ethernet. And we'll plan on seeing you at the next meeting.
Great.
Okay,
Thanks,
I'm going to
Greg.
call this meeting to a close. Thank you all. Thank you all for being here.
We do need a motion to adjourn the meeting.
Oh, we do, really?
So
Dr.
moved,
Kurt,
seconded.
Tori, okay. Dr. Kurt and Tori, and everybody raise their hand for an adjournment. I think we've got it. Anybody against adjourning? No, don't see that. All right, I'll see you at the next meeting, if not sooner. Thank you.